let's come back, and a very warm welcome again to everyone in this session 3 of on how to write and publish a research article in an international biomedical journal. So today we have a guest who is joining us all the way from Cameroon. He's a member of ISPRM, that is International Society of Physical Medicine Rehabilitation, and represents the country of Cameroon at the ISPRM Youth Forum. So right now we have participants from 4 different countries all around the globe participating in these online sessions. Now this is probably the most important session, as people have told me that please tell us how to actually write a research article or a thesis or dissertation. I have mentioned the word thesis and dissertation along with the research article because the principles of writing a research article or a research thesis or a research dissertation, they're almost all the same. So if you know how to write a research article, you will be hopefully able to write a good thesis and dissertation as well, if that's part of your training program. A very strange thing was that the organizer of this session, they received a couple of requests from different colleagues from different parts of the country that they only wanted to attend the session on how to write a research article. They did not want to attend the article on pre-planning, on the literature search, and on the ethic and the research misconduct part. But you know, those of you who have been with me in these 3 sessions, now you might have realized that what's the value of pre-planning before you actually sit down and start writing, and what's the value of doing a good literature search and to identify the appropriate articles for your thesis or your writing part, and what is the importance of following ethical principles while you plan research, while you do research, and while you write an article and send it for publication. So let's start. Again, as usual, we'll start with a story, and before the story, I'll share a quote. This quote is by William Zinsser. This gentleman is not a medical doctor, but he's a writer, a prolific writer. He's an American. He writes a lot, mostly writes fiction. But whether you're writing fiction, non-fiction, a scientific article or a medical article, you have to realize that writing is actually a very difficult thing. So if someone has told you that it's not, probably he or she is not clear about what article writing is all about. So please read this quote with me. Writing is hard work. A clear sentence is no accident. Very few sentences come out right the first time or even the third time. Remember this in moments of despair. If you find that writing is hard, it's because it is hard. It is one of the hardest things that people do. So does my audience agree or disagree with this statement? Is writing a difficult thing or an easy thing? So probably those of you who are planning to do some research, let me tell you very clearly, I mean, the perspective depends on person to person. But being like I myself, I'm from Pakistan. So English is not my primary language. It's not my mother tongue. It's my secondary language. I had to train in order to learn how to write in English language. So the global language of science is English. So I need to learn the art of writing good articles in English language. So even if my research is very high, good quality research, it was done ethically, it was done in the way it should have been done. The problem arises when I try to convert those results and those thoughts into writing. And if that writing does not make any sense, unfortunately, my research is not going to be published in a reputable international biomedical journal. So we have to understand that writing is actually a very difficult part of the whole paradigm of research. Again, start with a story. Dr. Amreen has completed the research work and the results are ready. How should she start writing her research article? Any ideas? So Amreen is a doctor. She's a physician or a resident. She has just completed the research work, data collection, data analysis. The results are in front of her. How should she start writing the research article? Okay, so Hafsa says start with introduction. Okay, any other idea? Okay, Dr. Freya says methodology, starting introduction and making an outline first. Select the target journals, read the instruction and then write. This is from Dr. Yusuf Jamal from Peshawar. Okay, anything else? Shafia says write the abstract first. We'll talk about it later, Shafia. Okay, Dr. Fawad says make an outline from start to the end. Dr. Kiran says follow guidelines. Again, Fatma Zahur says write an abstract. So we'll see what is the right way of doing it. So you need to understand that one can write the section of a research article, a research paper, a dissertation, or thesis in any order that they want. That's the first thing you need to understand. There's no one set pattern that which section of the article should be written first of all. Once you write an article, there's a set pattern that I'm going to discuss, that it starts from the title, the abstract, the keyword, introduction, material, method, result, discussion. But whatever section you want to write first, you can write first of all. Number one. Number two, you don't have to wait till the end or when the results are ready that you start writing. You can actually start writing even when you're collecting data. And you can actually start writing, and this is a suggested order, you can agree or disagree with that, and we can discuss that in the chat box, that first of all, please start writing from the methods and material or the methodology section. Because please remember, method or methodology section is the one which is most critically reviewed by peer reviewers in order to assess whether this research is worth publishing or not. Methodology is something that the researcher does him or herself. It's something that you can actually write with your eyes closed. Why? Because you simply have to narrate what you did. So, you know, like probably you can start with, we took an ethic review committee approval. We designed a cross-sectional survey. We designed our performa in Google Forms. Google Forms, you just simply give 2 or 3 lines what Google Forms are. Then this was the procedure of creating those Google Forms. We sent those Google Forms to experts for their comments and review. Then we ran a small pilot survey. And once we were clear, we finally created a form of 25 items. That form was sent to around 300 people via email, and the response rate was around 78% and stuff like that. So methodology is one of the most easiest thing to perform if you have done the research yourself. So one of the suggested ways is that often people have this thought block. It's very difficult to write on a blank page or a blank screen in front of you. It's a challenge. Where do you start? So you definitely do not start from writing an abstract. Why? Because abstract is the summary or khulasa of the whole thing. How can you write an abstract or a summary if you don't have a whole in front of you? So please, you do not start writing an abstract first of all. A suggested order is that you should actually start writing the methodology first. And once you are done with the methodology, you immediately jump to the next section, that is the results. So methodology ke baad kya cheez aati hai? Results. And if you think carefully, once you are done with your methodology and results, you are actually done with 25 to 30% of your article. And that's a big relief for anyone who's writing an article. And once you're done with that, now it totally depends on you whether you would like to continue with the discussion or you would like to write the introduction. It's totally up to you. But please remember, the abstract and the title should be finalized at the end of the whole writing process. And we'll discuss each of these sections in detail one by one. Okay, so this is the format of a standard research article. It is known as the IMRaD format, and most of you are probably familiar with this. The IMRaD stands for Introduction, Material and Method, Results and Discussion format. So this discussion format is actually taken from the Whiteside group. This was published back in 2004. It gives you a good idea on what are the important components of a research article or a thesis or dissertation. And if you answer all of these questions in your research article, there's a big chance that your article is going to get through. So first of all, let's see what entails a IMRaD format. Number one, introduction. Introduction means that you have to answer the question that why did you start doing this research work? What were your central motivation and background and hypothesis and aims and objective? This is the main thing that you address in the introduction part. Method is all about how did you try to answer this question? What was your methodology? What was the material, the participant, and the things that you utilized in order to get an answer? Results is simply what did you find? What were your answers? And discussion is please make a sense out of it. What do these results mean? what hypotheses were proved or disproved, and why does it make a difference in patient's life, in your community, in your organization, or probably in the healthcare system in the wider world. So if you answer these 4 critical questions in these 4 different parts, hopefully your research article or thesis is going to get through. And we are going to discuss now each and every of these components in detail. Now, once you are done with your article, this is a more complete view that you have to make a title page with author's detail. There's an abstract, keywords, introduction, methods, result, discussion, and acknowledgement, and in the end, references. Coming to the title. Title is the first thing which everyone reads. Agree or disagree? Title is the first thing which everyone reads. Thank you. Because please just go back. Whenever you do a literature search, what is the first thing that you read on Google Scholar or PubMed or Medline or maybe PubMed Central? It's the title. If the title is not catchy, if the title is not interesting, if the title is not conveying any useful information, it's very unlikely that you're going to read further. So title is the first thing that everyone reads. It's important in literature searching for the reason I just told you. It should be specific and mention the study design if possible. Please remember, specifically in cases of randomized controlled trial, the guidelines, they recommend strongly that the word randomized controlled trial or the study design should be part of the title if possible. So for example, you can have drug A versus drug B, a double-blind randomized controlled trial, or assessment of knowledge regarding COVID-19 in undergraduate medical student, a cross-sectional survey of 5 medical colleges across Pakistan or someone else. So if possible, please do mention the study design in the title. It makes it catchy, it makes it more useful. The title generally should not include any abbreviation like TB or stuff like that, or SCI, or maybe for example, BKA for below knee amputation or AKA for above knee amputation. But if there are certain standardized abbreviation like COVID-19 or probably AIDS, only then you can use it. But you have to read the instruction to author that whether they allow use of abbreviation in the title or not. Running title is a shorter version of the title that has to be made by the author and sent to the journal while submitting the article. For example, if you write an article on demographics and epidemiology of stroke in Pakistan, the running title might be epidemiology of stroke or stroke in Pakistan. So there's a big title, the complete title, and then there's a shorter version of the title known as the running title, which you have to make. How to write good titles? It's a challenge. Write multiple titles at the start of the research, 4 or 5 titles. And please remember, if you have done pre-planning, if you have a smart research question in front of you, now you can make really good research titles. And please keep on revising your research titles till you finalize writing your article. And always ask for feedback on your titles from your colleagues. Because please remember, you don't write articles and manuscript for your own self. You write it for the other people to read. So if your title is not making sense to your colleague, probably it's not going to sense to the wider community out there. So please write multiple titles and ask your colleagues for feedback. And once you just imagine, once you start writing your synopsis and once you complete your manuscript, your knowledge base has increased, your understanding of the research process has increased, and probably now you can make even a better title. It's very important to understand that whenever you submit a title for a synopsis or a thesis or dissertation, that title cannot be changed while submitting your dissertation or thesis or synopsis. But once you convert your thesis or dissertation or synopsis into a research article, you are authorized and you can easily, without any issue, a little bit change your title. Obviously, you can't change your title a lot, but you can change your title a little bit if you think that your title of your thesis wasn't that great or catchy, but now you have thought of a better title. So please do that. Why abstract writing is a serious matter? The abstract should be the best part of the paper. Why? Because it is the most frequently read part of an article after the title. Again, go back. Whenever you do research, whenever you do literature search, what is the second thing that you read after a title if the title is catchy or interesting? You only read the abstract. You don't even start reading each and every article that you come across. you first of all read the abstract. And what is an abstract? Abstract is a summary of the whole process of the whole research. I'm really sorry. I got disconnected. I'm sorry. I got disconnected. Karachi mein there are a lot of rain today. I got disconnected. I'm going to restart. I'm really sorry. My apologies. This was a technical issue. So, okay. So can everyone see the slide and hear me? Please mute your mics. Please mute your mics. I'm okay. Okay. Today we had a lot of rain and thunder in Karachi. The internet connection might fail, but don't worry. I have a couple of backup plans with me. So please don't leave the rooms. If there's an issue with the connectivity issue, I'm going to come back and restart. So my apologies for the technical problem, but I couldn't help it. Oh, okay. Can you see the slides? Can you see these slides? Importance of abstract. Okay, thank you. Please अपने mics mute कर लीजिए. Thank you very much. Okay, so abstract should be the best part of the paper. It is also used for indexation in Medline. Whenever you do research on Medline or PubMed Central, you would get actually the abstract. In many cases, they would link out to the full text, but Medline does not give you full text. And also, whenever reviewers get your article for review, they are only sent the title and the abstract. So if the abstract is not catchy, if the abstract is not interesting, the reviewer might not agree to review your article, and your article review process would get prolonged and you have to wait along. So please make your abstract really interesting. Abstract should be standalone. Standalone means complete and internally consistent with all the parts that you have written. You do not use any reference in the abstract part. Please remember that. You don't use any tables or figures or give any reference to the tables or figures in the abstract. Please avoid using abbreviation in the abstract. But if you have to use any abbreviation, they must be defined. So, for example, you can't simply write COVID-19. You have to write first novel coronavirus, and then you write this COVID-19. Or you might want, if you want to write SCI, you don't simply write SCI. First of all, you write spinal cord injury, and then you write in the bracket SCI. And the conclusion of the abstract should be based on the data or information presented within the abstract. A very wrong thing done by my colleagues is that once they write the article, they simply copy and paste the conclusion from the main manuscript text to the abstract. Please remember, the abstract is hardly 250 or 350 words. It does not convey the whole of the information that you have written in the manuscript. So that conclusion that you cut paste from the main manuscript sometimes does not fit in well and does not make any sense. So please remember that whatever you write in the abstract has to be internally consistent. That is, the conclusion has to be modified and molded as per the summarized data that you have presented in the abstract. So simple things matter most. If you want to write a good article for an international or index biomedical journal, you have to follow these principles. Now, how many types of abstracts are there? How many types of abstracts are there? Okay, good, excellent. So many of you have said two. Can you name them? Can you name them? We will answer the questions at the end of the session, please. I have to finish the session in time. Excellent, Dr. Hafsa, thank you very much. Structured and unstructured. Thank you, Roma. Thank you very much. So as the name indicates, structured and unstructured. Thank you, Hafsa. Thank you, Yusuf. Structured means that there is a certain structure that has been provided by the instruction to author of the journal, and you have to follow that structure. That structure can vary from journal to journal. In some cases, it's very simple, that it might be simply IMRaD, that is Introduction, Material, Method, Result, Discussion. But please look at this article, original research article from JPMA, Journal of Pakistan Medical Association. The structured format for a structured abstract for JPMA is objective, methods, result, conclusion, and keywords. So if you want to write for the JPMA, please follow the instruction to author and write a structured abstract. This is again a big mistake that people make. This all is they assume that every journal follows the same IMRD format. It's not like that. You have to read the instruction to author. And look at this. This is another article. The structured abstract in this case, it has even more detailed. So it has got an objective, design, subjects, methods, results, and conclusion. So if you want to write for this particular journal, you have to follow this particular format. This is called structured abstract. An unstructured abstract is just like a paragraph. In many cases, it is written for a review article or a personal review or a short communication like this, the evolving role of biomarkers for osteoarthritis. So it's a review article, and as you can see, the abstract is in form of a paragraph. But surprisingly, even a original research article or a systematic review or a review article also might have a unstructured abstract. For example, this is an original research article based on intra-article corticosteroid injection in the hip and the knee. And this is basically a research article, but this is an unstructured abstract. So you have to read the instruction of the authors carefully in order to decide what kind of abstract the journal demands. Coming to authorship, I've discussed this in detail. I'll quickly skip over it, but you have to follow the ICMJ guidelines. And please remember, now it connects with the first session that we did in the pre-planning and the second session that we did on authorship. So if you have a criteria in front of you, for example, the ICMJ guidelines, it would make your life easier once you're deciding who should be the first author, second author, third author, depending on the contribution. And often they are listed largely from the greatest contribution to the least one. So please, if the youngest member of the team has contributed the most, he or she deserves to be the first author. It's a matter of principle and it's a matter of justice. General supervision of the research group, being a head of department, being the chairperson of the department, participating solely in acquisition of funding or collection of data does not justify authorship based on the ICMJ criteria, which is globally followed by most of the biomedical journals. An order of the author should be a joint decision of the author. Please remember, there's one corresponding author who corresponds and communicates with the editorial office on behalf of all the authors. But all authors have to sit down together virtually or in person, and they have to decide that who is going to be the first author, second, third, fourth, and so forth. In many Pakistani journals, they would actually ask you to submit a contributorship form in which you have to mention the contribution of each person in detail, number one. And number two, you have to write the sequence, who is the first, second, third, fourth author. And then the authors have to sign that performa and submit that performa along with the manuscript. This is being followed by many Pakistani and even international journals. So you have to be very clear who is going to be the first, second, third, and fourth author. Coming to the keywords, what is your concept of keywords? What are keywords? Keyword क्या होते हैं? What are keywords? And please remember, there's a difference between keywords once you are searching the literature, and there's a difference between keywords once you are selecting them or writing them as a writer or as an author. Once you are selecting keywords for literature search, your aim is to identify good articles or the relevant article for your research. Whereas in case of being an author, your aim is to identify the good keywords which actually enhance your article, and whenever someone does a literature search, your article should come up as possible, right? So that it gets cited, it gets the attention it deserves, and you can be a prolific writer. Okay, Abdul Aziz says words that highlight the main objective. Dr. Sajjad says those words which can be searched. Rabia says which can make search of an article related to theme easy. Thank you. Again, Hafsa says that can be searched easily. Kiran says main words. Okay, words like a hashtag to search. Ruqayya, not like a hashtag. Hashtag things are this is a bit scientific, and these have to be chosen very carefully. So let's do a little bit of exercise, and that will become clear. So keywords are the words that can be used to link your work to specific areas of research or topic. Should not be the words that are included in your title. Why? First of all, do you agree or disagree with this statement? Your keywords should not be the words that are included in your title. Number one, you agree or you disagree, and why you agree or disagree? Why do you agree with this statement? Your keywords should not be the same words that are already included in your title. Disagree. Okay, Sajad, why do you disagree? Both Dr. Sajad from Kashmir and Dr. Sajad Khatak. Dr. Fawad disagrees. Oh, wow. So the house is divided, but most of you disagree. So please give me some reasons. Why you agree, why you disagree. Agree because that will increase the chances of being cited. Good, Aisha. Disagree because main searches are from abstract. Okay, agree. Okay, come back, chat box ko chhodiye, come back to the session. So I would recommend that your keyword should not be the words that are already included in your title. Why? Because please remember that whenever you write a title, so your title is already broken up into different words or keywords by the AI or the artificial algorithm of Google Scholar or Medline or PubMed Scholar and all the indexation databases. You are being given an appropriate chance to use certain 5 to 7 keywords that are going to enhance the impact of your article. So your title is already being indexed. All those numbers, all those words are already being indexed sort of like a keyword. So please don't repeat it. You should choose certain other keywords representing your title, your research, but they should be a bit different from the word used in the title. We are quickly going to do some exercises and it will make your life easier and help you understand the concept. So some of the journals, they would demand that you should use only MESH keywords. I told you last time, MESH stands for medical subject heading. It's a database is of around 30,000 medical terms that is being maintained by Medline or the PubMed, the Public Library of Medicine from the USA. And it's advisable that you should use MESH keywords preferably. But in many cases, you can go beyond MESH keywords as well. So depending on your instruction to author, you can have 3 keywords, 5 keywords, or up to 7 to 10 keywords. Now, let me give you an example. So the title is Nestle yogurt in the treatment of gastroesophageal reflux disease, a complementary therapy. These are the keywords. Which one of these are good keywords and which one are not? Is GERD a good keyword? Is GERD, G-E-R-D, GERD, a good keyword? Why? No. Okay. Some say no, some say yes. Why it's a good keyword? Why it's not a good keyword? Okay, Dr. Shazia says it's an abbreviation. So what's the harm in using abbreviation? Okay, please remember, sometimes using the standardized abbreviation is actually a very good strategy. So GERD is actually a very smart and useful keyword. Please tell me how many of you use the word gastroesophageal reflux disease in their common language in day-to-day communication. Nobody uses this word. Most of us use the word GERD, G-E-R-D, GERD. And even our patients, they use the word GERD whenever they are searching for an article or literature online with Dr. Google. So if you use GERD, it's actually a very smart keyword. The word gastroesophageal reflux disease has already been indexed or converted into a keyword by the AI algorithm. Now, using the word GERD actually enhances your article, and anybody who uses the word GERD is going to hook your article. So using these kind of standardized and internationally recognized abbreviations is actually a good strategy. So GERD is a good keyword. What about yogurt? What about yogurt? Is yogurt a good keyword? Why it's not a good keyword? Because it has already been used in the title. So why you're wasting your chance to use another good keyword? What about complementary therapy? Not a good keyword. What about randomized trial? Is randomized trial a good keyword or a bad keyword? Okay, Dr. Hafsa, why it's not a good keyword? It's a good keyword. Oh, sorry, Hafsa says good keyword. Okay, why it's a good keyword? Because normally whenever we are trying to evaluate the effectiveness of any intervention in case of a disease, let's say like GERD, so we normally conduct a clinical trial or a randomized control trial. So although we have not read this article in detail, but probably the study design of this article is actually a randomized control trial. So the author has very carefully and selected this keyword, and now whosoever uses the keyword like GERD or acid reflux disease and randomized clinical trial is going to hook up this article. So this is a good keyword. What about acid reflux disease? Again, it's also a good keyword because many patients would use the word acid reflux disease to identify articles related to heartburn or GERD or gastric problems. Coming to the next one, safety and efficacy of prolonged vincristine therapy in breast cancer patient, a randomized control trial. Quickly, please make good keywords. Write some keywords. Come on. I would request everyone to participate. Even, and especially our colleagues from Cameroon and from Saudi Arabia, I'm waiting for your answers. Please write some good keywords in the chat box. Oops. Can you see now? Safety and efficacy of prolonged vincristine therapy in breast cancer patients, a randomized control trial. Mohsin, can you see? Mohsin? Is the slide visible now? Breast cancer. Okay. Oops. Oncology, good Hafsa. Chemotherapy, Dr. Aisha, fantastic. Dr. Sajad, vincristine is not a good keyword because it has already been used. Carcinoma, Dr. Adnan, good. Dr. Fatima, vincristine is not an appropriate keyword. Anti-cancer drug, anti-neoplastic drug, good, excellent. Randomized control trial is not a good keyword, it has already been used. Cancer, chemotherapy, chemotherapeutic drug. Randomized control trial, no. Okay, so let me give you a list of keywords. Look at this. For cancer, you can use the word carcinoma, neoplasm. For what is vincristine? Vincristine is anti-neoplastic therapy. It's chemotherapy. How do you assess the safety and efficacy of chemotherapy? You use certain outcomes. And what is this? This is probably a clinical trial. So this is how you use and select good keywords that enhance the effect of your article. And whenever people are using different keywords to identify their relevant articles, your article comes on the top, it gets cited, it gets quoted, and you become a good prolific writer. So is it clear? Should I move forward? You will get all the slides, so you don't need to write actually. Okay. Please comment on this. The title is Effect of a partially hydrolyzed whey infant formula supplemented with starch and lactobacillus reuteri DSM 17938 on regurgitation and gastric motility. So these are the keywords. I have, okay. Is the slide visible now? Okay. I'm sorry, today probably you're having technical issues because of the rain and thunder in Karachi. I apologize for that. Yeah, keywords are visible. Which of these are good keywords? Which, okay, please identify the good keywords in this example. And by the way, this is our internationally published article. So my aim of telling you is that anyone can do mistakes. If the article is published in a high-ranking biomedical journal, does not mean that's a class A article or a fantastic article. People do make mistakes, whether they are working in Pakistan, whether they're working in Africa, they're working in Australia or Europe or USA. So people do make mistakes. Look at this. Many inappropriate keywords. Infant formula, it is being repeated. Regurgitation, repeated. Hydrolyzed whey, repeated. Lactobacillus, repeated. Starch, repeated. So this is only probably one keyword, gastric emptying, that is an appropriate keyword. Rest all of the keywords are probably classified as inappropriate keyword, right? This example also answers a question which probably Dr. Fawad raised, and the question was, how long should be the title? There are two answers to this question. Number one, please read the instruction to authors. In many cases, they give you a limitation of the number of words and number of characters that you can use in a title. Many journals do that. But in case the journal does not have any limitation, so please see this. This article title is actually consists of 3 lines. It's a huge title. but this title is conveying a lot of good information. So the title is really good, but the keywords are inappropriate. So this also answers the question that how long should be the title, and the answers are two. Please read the instruction to author and follow whatever limitation they have given you. And if there are no limitation, then you might want to make a very comprehensive title like this one. But please remember, it should be informative, it should be catchy, and it should actually attract the attention of the people who are doing literature search. Okay, moving forward. Now coming to the introduction part, how to write. So what do you write in the introduction part? What is your understanding? What is your understanding? Introduction में क्या लिखना चाहिए? What do you write in introduction part? And please remember, now I'm going to discuss the principles, and these principles are applicable in every field. So whether you are from orthopedics or dermatology or gynecology or rehabilitation medicine, physical therapy, any field, ophthalmology. So these principles are applicable to any field. If you follow these principles, your article is going to be a good one. Thank you very much, Dr. Khalid. Very good point. Why do the research? Excellent. Yes. Anything else? Background. Okay. Why I did this work? Maria, good. Dr. Amara, short information about the topic itself. Okay, good. Dr. Sajad, why are you writing this research? Background, objective, rational. Oh, fantastic. Very good point by Dr. Sajad. What gap was there in the previous work? Ruqayya, rational. Fantastic. Thank you very much. So the principle is that your introduction should have two important things. Please remember the principles, two important things. Number one is background information, which means what have others done in the past, and please provide evidence supported by a limited number of relevant references. It means that you have to connect your work with the work done in the past. Please remember what I told you in the pre-planning phase. If I have seen further because I stand upon the shoulder of giants, people before me in this field, they worked hard, they created good research, they published a lot, and that's why today I'm able to teach, train, and do my own research. So I have to connect my research to the research done in the past. And this is what introduction or background is all about. So the word used sometimes is introduction, sometimes the word used is background. They both mean the same thing. But you have to first of all mention what have the other done in the past, and for that you have to provide evidence. And how do you provide evidence? You provide evidence by giving certain number of references. Now a very important thing, many journals have a limitation on the number of references that you can use. For a research article, usually they allow somewhere between 25 to 35 references. As a principle, please remember, do not use more than 1/3 of your references in the introduction section. So if you have a limitation of 25 references and you have used actually like 15 to 18 references in your introduction, so how are you going to fill up the discussion part? From where you are going to get your references for the discussion? It would become very challenging for you. So as a matter of principle, please only use 1/3 of your total number of references in your introduction section. Number two, as CPSP tells us and many other our seniors tell us, the introduction part of the article must end on the aims, objective, purpose, and hypothesis of the study. That is, why are you doing this research and what is so different and special about your research? I'll give you one example. Probably I gave it earlier as well. A researcher wants to do a research on epidemiology and demographics of cerebral palsy in Pakistan. Now we know that a lot of data has been published on this topic in the West, particularly in Europe and USA, where you might find a cohort of 20,000, 30,000, 40,000 patients with cerebral palsy. But this researcher plans to collect data from 5 centers in Karachi. It's only a sample of 1,500 patients over 1 year. How would you actually convince the editor or the peer reviewer that this is a good research? So you might want to start as, first of all, you might want to give a definition of what. My apologies again. I went offline again. Just give me a second. Sorry. So can everyone see this? Can everyone see my slide on how to write? Okay. So I was giving you an example of a researcher trying to write about cerebral palsy in Pakistan. So how would he or she start? So probably introduction for him, specifically in that context, he or she would actually start with the definition of cerebral palsy, probably a standard definition of cerebral palsy accepted all around the globe. Then he would actually comment on that cerebral palsy is a pediatric childhood disability disorder that has been researched in detail in Europe and USA and Australia. And then he would give a couple of references to the good research article published on the demographic of that cerebral palsy in different countries. Then he would actually write that despite having a lot of cases with cerebral palsy, there is no data, no large scale data available on childhood disability and cerebral palsy in the developing world, particularly in Pakistan. This is the first large scale epidemiological study spread over 5 centers in one of the largest cities of Karachi, which would document the detailed demographics and clinical patterns of cerebral palsy in children less than maybe 15 years of age. Now, this is how you convince and how you make your point and how you create your rationale that why your research is important. And that brings to me another. Please give me 1 second. I'm changing my internet connection. Give me 1 second. I'm changing my internet connection. Just give me a second. I know. Yes. Just give me a second. I'm going to change my internet connection. Just give me a second. I'm going to change my internet connection. Just give me a second. I'm going to change my कम अज कम एटलीस्ट कराची वाले समझ सकते हैं आज जो गरज चमक के साथ बारिश हुई है तो इससे काम खराब हुआ है so really sorry. Okay, coming back. What to write? Yeah. So okay, am I visible? Am I audible? These are challenges of working in a developing country. This is how life is. So it's pretty easy that you're based in Europe and USA and you have access to world-class research and resources and you can do everything, learn everything. It's a challenge to, work in developing countries with these kind of things and then to teach and learn. But thank you very much for being with us. So this is how we make a strong case for our research. I was talking about a question that was sent to me via email, that what is the importance of doing duplicate research, or what we called the Me Too studies. So the Me Too studies are that if a research is done in one part of the world and you want to duplicate that research in your own context, these are known as the Me Too studies, maybe, but these can be very important studies if nothing is available on that topic in your part of the world. I just gave you an example of cerebral palsy. So there might be a research on 20-40,000 people with cerebral palsy in the Europe or in the West, but there's no research available in Pakistan even on 2,000 cohort of a cerebral palsy patient. So if you want to do that research, that's a Me Too research, but that's a very important research. For example, you have read in the books and journals that drug A is better than drug B for a particular disease, but you have never seen a research being done in Pakistan on that topic. So if you do research on that topic, on that particular intervention in Pakistan, that is going to be a valuable research. So Me Too studies are valuable. They can be done. They are pretty easy to do because a template is available. And if you make your case strongly, they can be published in good research articles, in good research journals as well. Coming to the methodology, please remember methodology is the most important part of an article, because for most of the international peer reviewers, they base their decision of accepting or rejecting an article on methodology. If the methodology is weak, there are issues with the ethic part, if there are issues with the study design part, if it's a clinical trial, if there are issues with the randomization and blinding part, your study is in serious trouble. So please spend a lot of time in methodology, and you can only write and understand methodology if you do good pre-planning and if you consult your biostatistician before you start planning your research. The most important thing is that you must have an approval of the research by an appropriate committee. It could be your ethics review committee or it could be institutional review board. The name can be different, but it's a committee, an official committee, which is almost available in every institution right now in Pakistan, and they have to give a permission, a formal permission with a certificate that we have reviewed your proposal, your article, and it is good to go. Please remember that no index biomedical journal in Pakistan and most of the international biomedical journals they do not accept or publish your research article if there is no ethics review committee approval or IRB approval. And you don't even have to only mention, at least the Pakistani journals, they would actually ask you to submit a scanned copy of the ERC approval letter or the certificate. So it's not possible that you simply write that ethics review committee approval was obtained. They want a proof. So it is only possible if you do good pre-planning. Why? Because in many institutes, the IRB takes a lot of time before giving the approval. And they actually might not give you approval, and they might ask you to revise your proposal or your research. So please spend some time in pre-planning and get the appropriate approval right from the start. One question: what if you are a private practitioner or your institute does not have a functioning IRB? What should you do then? Yes, every research work related to humans and animals require an IRB or ERC approval. Yes, I mean, this is the norm. This is the question from Dr. Abdul Aziz. So I just want to answer that. Hafsa says, do they charge for certificate? No, Hafsa, if you're working in an institute, they don't charge. No, Dr. Sajad, I'm sorry, you will not get any approval from another institute and from other medical college. It doesn't work that way, because it's a hard work. People don't spend time doing work for others. And number two, it's not legally allowed. They're not legally supposed to give approval to other people. So those of you who are having problem with ethics review committee approval in your own institute because of lack of availability or lack of planning or lack of cooperation, you can always go to the National Bioethics Committee of Pakistan, NBEC, National Bioethics Committee of Pakistan. You can Google it out. They do charge for this service, but they would give you your ethics review committee approval if there's no committee available in your institute, or if there's no one available to guide you. So you can always go to the National Bioethics Committee of Pakistan. Moving forward, the study design is one of the most important things. I just told you that you have to mention the study design, but you just have to mention the study design, and you don't have to like give details. But in some cases, they do ask you that please justify the study design. If that's the case, you have to follow it. Usually you have to include the following if applicable. For example, the settings, time duration. For example, what does setting mean? Whether the research was done in hospital setting or community setting. If it was done in hospital, whether it was done in outpatient department, emergency department, or inpatient department in the wards. Whether it was done in the oncology ward, pediatric ward, dermatology ward, psychiatry ward. You have to mention each and everything in detail so that the reviewers and the readers can understand what you did. Then time duration. Again, usually you mention only the month or the year, depending on the kind of research you are publishing. So you might want to say a randomized control trial of drug A versus drug B, was conducted from January 2020 to December 2020 and stuff like that, right? Then depending on the research you are doing, you might want to have, you may have to mention the equipment. This is very important for those specialties who use equipment to provide service to the patient. For example, if you're working in physical therapy, you use a lot of tools. You have to mention the make, the type, the model, and the manufacturing country of that tool. If you're working in biochemistry or pharmacology or basic medical sciences and you use certain tools, you have to mention each and every tool in detail. If you're using organism, or let's say for example animals, you have to mention the height, the weight, and every detail about the animals, how they were kept, how many days or months old they were. If you're using reagents, if you're using tablets, you have to mention diclofenac sodium 50 milligram tablet in a capsule form or a liquid form or whatever form it is, and how it was dispensed. You have to mention each and everything in detail. That's part of methodology. Moving forward, then you have to describe the subject or population characteristics, which we call demographics. They should at least include the gender, the age, the educational status, the marital status. Please remember, many a times, many demographics are not related to the data you are collecting. So if your data or your outcome measures do not correlate, or they are not related to the educational status or the marital status of the patient, you don't have to mention that. Please remember, there is a limitation of words that you can write in an article. Usually it ranges from 2,500 to 3,500 words. So the word count is limited. So please do not put in unnecessary details. You don't have to mention each and every demographics in detail. Simply mention the important demographics in the text and then summarize remaining of the demographic or the whole demographic pattern in the table. Last thing, and very important, if you are using a scale or a questionnaire, please do get permission. Many a times what people do, they simply go online, they Google out a questionnaire or a scale and they start using it without realizing many of the questionnaires and scales, they are copyrighted either with the author or with an organization or with the university. So if you use a scale and questionnaire without appropriate permission, you might land into trouble, because once that's going to be published, that organization or person or institute might ask the editor that they have not asked us for the formal permission, and please ask them. And in some cases, you will get the permission free of cost, being based in a developing country. But in many cases, the institutions or the organization, they charge a lot of money, and it depends on the number of participants that you are having. So there will be a difference between 100 participant study and a 500 participant study. So please use the scales and questionnaire by permission. And by the way, doing a questionnaire based study is a really fun thing. The questionnaires has already been validated. So you actually go online, and if that has been created by an individual, a person or a researcher, you email them respectfully, you explain all the procedure, and you simply say them that I want to replicate this research with this questionnaire in my part of the world. And many a time people are very enthusiastic, and they would give you permission to do that, use that questionnaire in your own context, and then you can actually modify that questionnaire as per your own needs, and it becomes a very good study to do. We have done a lot of studies like this. So you can use questionnaire and scales, but after getting permission. Please remember, statistical method detail is part of the methodology. It's not part of the results section. Results may you write what were the results, but how did you reach those conclusions? How the data was collected retrospectively, prospectively, who entered the data, whether a data collection sheet was used, it was an electronic data collection or a manual paper and pen, whatever it was, you have to mention all these things in detail in the methodology. This makes your methodology strong and worthy of publishing in international journal. Coming to the results, it is also known as the core of the paper. It includes table, figures, or both. The important thing is, please only summarize the important findings rather than providing data in great detail. You don't have to mention each and every piece of data in detail. Simply summarize the important things and use rest of the things for the tables and the figures. You don't have to comment on any of the results in case of I'll take the question in the end. Abhi time ka upar ja raha hai, I'm sorry, we'll take question in the end. So you should present the results, but never comment on them, whether they are good or bad. Uske liye there's a discussion section. The common mistake that people make in the results section, number one, illogical sequence of data presentation. The usual sequence is you start with demographics, then disease presentation, intervention, outcome, and complication. But if you start with complication, then you start writing demographics, outcome, it becomes a hodgepodge. So illogical sequence of data presentation is one of the common mistakes that people do. Repetition of data. Please don't repeat your data again and again in the table, figures, and the text. Repetition is not allowed. Unfortunately, I know that many of my colleagues who write dissertation and thesis are told by their supervisor, their peers, and their colleagues that you have to complete 80 to 100 and 120 pages somehow. So what do? First of all, they write it in the text, then they make a colorful table, and then they make a figure out of it. It's simply a duplication or triplication of data, which is not allowed absolutely in case of a research article. Because in case of research article, you have a limitation on the number of tables, figures you can use. So please use it carefully. Misplaced information between material, method, and result section. That is, instead of describing the details of statistics in the method, you start describing it in the result section. Overuse and abuse of table and figure. I'll give you an example. And writing conclusion in the result section. Don't do that. Okay, yeah. Can someone interpret this confusing graph? It's a pretty confusing graph. Can a brave participant? Oh, Dr. Adnan, no. Dr. Aisha, no. Dr. Afshan, no. Dr. Dr. Yusuf says yes. Come on, Yusuf, yes, please. If you want to unmute yourself, please unmute and then explain this graph. Dr. Yusuf, would you like to explain this graph? Okay, because of paucity of time, I'll be a bit quick. In reality, honestly speak, okay, sorry Yusuf, Mohsin, आप Yusuf को कर सकते हो unmute, Dr. Yusuf Jamal, Yusuf Jamal. Okay, Yusuf, here you go.
Assalamu alaikum, sir. Thank you.
Wa alaikum assalam. Okay, so Dr. Yusuf is going to explain this graph. He's an ophthalmologist from Peshawar and happens to be the younger brother of one of my good friends. Jeep, Yusuf, please.
Okay, sir. I will try, and you will help me out.
Yeah.
Okay, sir. So this is a 3D bar graph.
Yes.
It is a figure of 3D bar graph, which shows 4 medical journals: JPMA, JPMS, JCPSP, and IMRaD Medical Journal, and they have collected the data from 2001 till 2013.
Good.
Among all the journals, the JCPSP, they have higher number of articles related to medical education in 2013.
Why do you say that? Why do you say that they have highest number of articles?
As compared to JP.
But Yusuf, what if I say that this?
No, sir. It was JPMA. The JPMA has the highest in 2001, and second is JCPSP 2013. It is 15, because on the left side, on the y-axis it is 15 and 20. That's
so,
what I think.
Okay, so probably you are interpreting it as 15 and 20. But what if someone interprets it like 20 in case of JCPSP and 15 in case of JPMA? And the most important thing is, what about the data that is being hidden by this long graph, the bar? So in simple, thank you, Yusuf. You can mute yourself. Thank you very much. This is actually an article from our own research, so we can critique it and we can make fun of it. So for my Pakistani colleagues, basically ये एक इंतहाई वाहियात ग्राफ है. इसका ना सर है ना इसका कोई पैर है. इसको आप इंटरप्रेट नहीं कर सकते. We made this graph because we were just learning research and we wanted to impress others. So we thought of making a 3D graph. You don't make 3D graph for your research, especially once you are publishing. You make a simplest of the graph and the simplest of the tables and simplest of the figures. Please don't make a complex graphs like these. They don't serve any purpose. They only create confusion. We actually converted this confusing graph into these kind of simple graphs, from one graph to two graphs. Number one, medical education articles in each journal. So I'm giving you a simple figure, 60, 42, 12, and 4 for PGMS. And I can also give you an information that the 13-year trend of publishing medical education journal articles in these journals. And I can also make a claim that this trend is on the rise in the last 3 years, as explained by the last curve, which is going up, 6, 13, and 22. So this is how you convert a complex graph into a simple thing. Please remember, you write for others. You don't write for your own self. You don't write to impress. You write to communicate. The simpler, the better, right? Okay, coming to the last part, the discussion part. Mohsin, sorry, charger. So discussion is said to be the most difficult part of a paper to write. Agree or disagree? Charger, I need a charge. Right. So discussion is actually a very difficult part. Why? Because इसका ना कोई सर होता है ना पैर होता है. वो कहते हैं ना कि नील के सहाय से लेकर ताबखा के काशगर और फिर भी घोड़ा चलता जा रहा है. You don't know where to start and where to stop. There's so much to write, right? So I'm going to give you some principles that are going to make your life easier. So whenever you write a discussion, you should begin with a brief summary of the main finding, the important summary finding. I'm not saying that you rewrite all your results. You don't, please do that. Simply start with summarizing your important results in the first paragraph of the discussion section. Then you start writing in short paragraphs and you keep on discussing 1 point per paragraph. You're not getting my point? First of all, identify the important theme, the important results, the important highlights of your article, and start your discussion from those important highlights. Build your discussion around those highlights. And in each paragraph of 5 to 6 sentences, now start discussing each of the points. It would keep you focused and it would help you write a good discussion. Ideally, your discussion should not exceed half of the length of the whole article. I mean, if your article is, for example, 3,000 words, probably it's a good idea not to expand your discussion beyond probably 1,200 to 1,500 words, because too much discussion means that your introduction, result, and method would squeeze down, and it would not give a good look when the reviewer is reading the article. And the most important thing that you need to understand is that after reading your discussion, it should answer the question, the hypothesis, the aim, objective, and rationale that you raised in your introduction. Now it all comes together, that the aims and objective in the introduction, they should actually meet or should be answered in the discussion section, and that makes your discussion a complete one. You can also do the similarities and differences to the previous finding, and then you can discuss what are the possible reasons for these differences and similarities. And then you can also discuss what are the application of your research finding in the healthcare, in public policy, and even in industry and academia. So if you follow these guiding principles, it would keep your discussion focused. There's a section called strength and limitation. Please remember that writing an article is actually like selling your product. Millions of researchers and physicians and healthcare professionals are writing articles almost every year. So you have to sell your article. So please mention the strength of the studies. You had superior method. You used lot of outcome measures. You used more data collection. The last data collection on this topic was 50 patients, but you had access to 350 patients. So please be bold and upfront about it. Mention the strength of your studies, but at the same time, do not forget to mention the limitations. There is no perfect research in this world. Every research has certain flaws, whether it is a randomized control trial from USA or UK. So if you have an insight and if you identify your own limitation, it would actually give a good impression on the peer reviewer and editors that you have an insight into the limitations of the research that you have done, and it actually goes to your own credit. So what is this? What is this? And what is the relationship of this hourglass to what we have done? By the way, we are almost done. We are almost done. I'm sorry, I'm overshooting my time. So, but it's important, so that's why. Time. Anything else? Any other interpretation? Time. Hourglass. Thank you, Dr. Yusuf. It's the structure of the research article. So you start with the very vast background. You have a lot of data from which you can pick and choose your articles and write the introduction. But your introduction ends with a very specific hypothesis, question, or aims and objective. Method, material, and results per se are very simple, but they are the critical junction that actually connects these two parts. Discussion should start from a focused perspective, and then you can expand it as much as you can, answering the question that how does it relate to other studies, similarities, differences, strengths, and limitation. So this is the overview of a structure of writing a original research article. The last part is acknowledgement. It's optional, and it's a place to thank people who helped with the work but did not make contribution deserving authorship. For example, probably your supervisor who was there and who was not there, probably your colleague who lent his laptop, probably your colleague who collected 5 or 10% of the data, probably your wife or your spouse who supported you in the process, and people who actually guided you. But please remember, you have to obtain permission from people you wish to mention. Again, example, look at this. This is acknowledgement from an article. Appreciation is extended to recruiting centers. First of all, they appreciate the recruiting center. And in the end, they also appreciate people like Kristin Finn and Sarah of Nestle Nutrition for their clinical and logistical contribution. And look at this beautiful acknowledgement. I like it very much. So look at the wording. I express my deepest gratitude to my PhD advisors at the university who initiated my excitement for HMO research, to my postdoctoral advisor. So again, in life, we meet many people. We can have many supervisors, many teachers, many facilitators, many mentors. Ideally and honestly, not every mentor and every supervisor and every person who teaches you one thing deserves to be an author. If you want to honor them, please thank them, send them gift or give a bouquet or a cake, or mention their name in